Hi, everybody. This is Ernesto, and I'm the founder of Cat Family Therapy. And once again, I have Dr. Robert Pate. And Dr. Pate is one of my all-star clinicians at Cat Family Therapy. But before we move on, I'm going to have him introduce himself to you. Hi, Robert.
Hello, Ernesto. Every time you say that all-star thing, it takes me back to my sports days, and I miss it. I sit in this chair all day, and I miss running around and hitting balls and whatever
Right,
else.
right. Exactly.
Oh, well, I think you asked me to introduce myself before I went on down memory lane there for a second. So I'm Dr. Robert Pate. I'm a licensed clinical psychologist, and I do a lot of work with couples and men
Mm.
and working with people who've experienced trauma. And I'm just excited to chat about kind of how all those things come together today.
Yeah. Before we went on air, you mentioned something incredibly important because a lot of times we don't know how trauma and grief and all of that shows up in relationships, especially with couples. I want you to speak to this because this is a thing now since a lot of us are at home with our families and, we're together a lot and things can come up. So go ahead and take us into this conversation.
Yeah, I in my work with couples, I find that one of the things that couples get stuck on a lot is these points where the partners kind of feel like they've done everything they can and they're not moving forward. And you think, is it that therapy doesn't work? Is that one of us isn't trying hard enough? And sometimes what it is, and I won't say a lot of the time or most of the time, I don't have any data on this, but some of the time what that may be a result of is that one or both of the partners have experienced some kind of trauma and that has gotten in the way of their relationships. And because marriage is such an intimate relationship, any trauma that we've experienced, particularly with other intimate people in our lives, and by intimate, I just mean people that we've been close to. So therapists might call these people attachment figures. This might be your primary caregivers when you were younger, or maybe previous dating partners or spouses. But anytime we're talking about relationship trauma, like somebody you've been in a relationship, another person with, if they have hurt you in some way, then that can kind of stick with you and get in the way of future
Yeah.
relationships. I'd love to kind of unpack that a little bit here and just kind of provide a therapist's perspective on what that looks like and maybe some ways that we can start to think about that, especially from the partner's point of view who didn't experience the trauma, excuse me, and maybe the person who is kind of experiencing the downstream results of
Yeah.
that trauma kind of indirectly through their partner.
And I think you and I, Robert, when we work with our couples and individuals, we try to get into the unconscious piece, right? The part that is driving the behavior. And many times people don't understand how trauma and even grief can drive certain behaviors. And sometimes when it explodes in certain areas, and one of the spouse goes, "What just happened?" Well, when you
Mhm.
have that kind of confused, what just happened, uh, um, reaction, that's coming from a very, very deep place in your soul.
Mhm. Yeah, and one of the things that I often will talk about with my couples, whether there's a trauma history or not, is that when our partners do something that seems unusual, that our first reaction is not usually to be curious, but it would probably be most helpful for our first reaction to be curiosity. A lot of times our partner does something kind of out of nowhere. They have some kind of big reaction. What they say is disproportional to the situation, at least from our perspective. And instead of being curious, we may lash out at them, retaliate back, maybe we withdraw, right? So whatever the reaction is, it's probably not nearly as helpful as saying, whoa, what was that?
Yeah,
Are you okay? What just happened there? I feel like I lost you for a minute there,
yeah,
right? So we lose that curiosity because we're protecting ourselves.
yeah,
And unfortunately, what's often happening is that our partner is doing something that's protecting themselves.
yeah,
And they're
yeah.
protecting themselves from some foreseen danger that may or may not be real.
Yeah.
Right. So
And
when we think they're overreacting, it's probably true that they're probably responding to something other than what we just said or did.
yeah, and it's we just become the representation of that which is inside of
Hmm.
them. And so sometimes in the moment we just take out our aggression, our frustration, onto our loved ones. But the underlying issue of this is possibly unresolved, unconscious information and resources that is just there stuck. And so sometimes when you have these outbursts, and you yourself, if you are the one that's having that outburst, and you're thinking, what the heck is going on with me right now? That kind of reaction could definitely be something that you need to address as soon as possible, because sometimes those explosions, right, Dr. Pate, that those explosions can single-handedly take down a relationship and create resentment, wouldn't
Yeah.
you think?
Yeah, and a lot of times, I mean, our partners can be very forgiving, but I've just seen so many couples where it it reaches a breaking point, right? And they say, I've
Right.
been patient for X number of years. You know, I've been patient for 2 years or 10 years or 20 years, and nothing's changing. And I've done everything I can. I'm kind, I'm accommodating. You know, I try to say all the right things. I try to give you space, and nothing seems to work. And so at that point, sometimes couples therapy, as helpful as it can be for a lot of issues, it may need to become just an adjunct or kind of a side treatment for
Right.
what really is the primary underlying issue, as you mentioned there, that maybe there's a trauma for one of the partners, or sometimes even both partners, that needs to be addressed more at an individual level.
Yeah.
I think that our partners can be huge healing factors for us. If we've been through something difficult, especially relationally, a healthy relationship can help to start healing that. You know, people talk about our brains being plastic, having neuroplasticity or kind of a malleability that we can rewire our
Yeah.
circuitry. But there are some limitations to that, and sometimes there are specialized treatments that are needed to impact that trauma history more so than whatever our partners can provide by themselves.
Yeah. And here's the other thing, and we're going to take it to another conversation where the person who's exploding, or the one with the energy and just taking out that aggression onto their loved ones, the other person is not off the hook here. Sometimes the person who is on the receiving end may have something psychologically, emotionally that they've not dealt with as well, that may have
Hmm.
activated from that interaction from the other spouse. So what we're saying is that it could be a perfect storm, if you will, right? Where each
Hmm.
one of them are responding to something unconsciously beyond what they know at the top of their heads, wouldn't you say?
Oh, absolutely. And this is where we can heal each other, and yet sometimes we can make things a lot worse for each other too.
Yes.
You know, I'm not certainly not the first person to say something like this, but you know, the people that we're closest to tend to get our best and our worst. And sometimes when we get into a difficult cycle with our partners, sometimes they don't get our best anymore. They just get our
Yep.
worst,
Right.
because we're doing everything we can to hold it together, and we're, you know, just with some string and scotch tape as we go through life, and it's so fragile. And we know that if I can keep it together at work, maybe I won't lose my job, right? But I can't do it all the time. So I put 99% of my energy into keeping everything together very fragilely at work.
Yeah.
And then I get home and I just don't have anything left in the tank. I can't keep it together anymore for my partner. So so we end up taking out the worst of our difficulties on our partners. So as much
Yeah.
as they can be healing, sometimes we both bring our stressors and our traumas and our difficult relationship flaws that we have, that we kind of keep together for some relationships. We bring the worst of that to our most intimate partners.
Yeah. And sometimes within those moments of of vulnerability, right, it explodes. So how does this look like in general as far as behaviors? It could look something like this. One partner explodes on the other partner and says, uh, "You're not doing the dishes. I need you to do the dishes. It's been there for some time." The other partner would become very elevated and says, "Don't talk to me like that." Now, when that comes out, that comes from a deeper place of respect or disrespect, or maybe it comes from
Mhm.
a place where their parents back in the day disrespected them and nagged them about washing the dishes. And so now the spouse who's telling the other spouse, don't do the dishes right now, or I need you to do the dishes, that other person from the receiving end is going back in time, right? When that unresolved issue of being
Hmm.
disrespected comes in. I mean, wouldn't you say that that is a very natural cycle, unfortunately?
Yeah, yeah, and I mean, I'd love that you mentioned the dishes, and I wish I had a nickel for every time I've heard people talk about doing the dishes and what issues it brings up or not doing them. Actually, it's usually the problem. Um, but it's such a common thing and so mundane, and it's not a big deal, right? I mean, if the dishes don't get done, okay, maybe your kitchen's a little stinky the next day, but other
Yeah,
than that, what's the real consequence, right? It's really not a big deal. And yet sometimes we have these huge reactions. And I say sometimes, and yet it's a pretty common thing. So, what you're getting at there, if I'm hearing you right, is that we're responding to other things. Right. So when somebody blows up about something silly like you didn't do the dishes, you didn't take the trash out, you didn't bring down the laundry baskets like I asked you to, right? I'm speaking from experience here, the things I forget. So any of these things that come up, these little tiny issues in life, it's not like you forgot to send the mortgage check and now our credit's taking a hit, so we can't get that car loan that we need. The little things, right, day to day. When we have these little things turn into explosions, it's probably because that fear center on our brain is activated. We've got our amygdala firing and it's saying danger, danger, danger. But it's not because the dishes are dangerous. It's because the dishes represent something else. It represents you don't care about me. It represents I'm not important.
I'm
Maybe
not
it represents
valued.
yeah, I'm not valued. You're going to leave me. I don't matter at all. How I feel doesn't matter to you. And maybe so then it's not the dishes. It's something bigger about the relationship that's been brewing for a while. And maybe that for a while existed even before this relationship started.
That's right. That's right. That's right. I love this conversation because this is a common thing. Now, if you're listening and this is happening in your relationship, unfortunately, you're not alone. Actually, fortunately, you're not alone because we have experiences that creeps up in our relationship, in our attachment, and everything around us is a representation, right? Uh, Opening the door, doing the dishes, making sure that you say please and thank you. Those things really matter in life, doesn't it?
Yeah, I mean, they're these little indicators of how people feel about us. And
Mhm.
so if those little things aren't there, we can put together a larger narrative. And so much of how we respond to people in relationships is based on that greater narrative that we've created based on our perceptions of their behavior, and it may or may not be based in reality. And I tell my couples all the time, I don't know what really happened, and for the most part I don't really care either, because we may never know. The second that a memory gets encoded in our brain, it starts to get modified.
That's right.
Every time we access it, it has a chance to get modified again, so we may never really know exactly what happened.
Yep. Yep.
So it's not worth arguing about. It's more about, am I being respectful and kind to you as we talk about it, and can I acknowledge how it impacts you
Yeah.
rather than whether it's true or not.
Absolutely. And in psychological terms, this is called projection, right? This is the part of us that is there, but it just comes out in ways that we sometimes are not aware of. And we're projecting a lot of those things onto our loved ones. And you're right, our loved ones gets the best and the worst of us as well. So in moving forward, Dr. Pate, what now? What now, other than them
Yeah.
picking up the phone to call you and go, hey, Dr. Pate, I need your help because everything that you and Ernesto was talking about is exactly what's happening in my relationship. So what now?
You said something that I thought was kind of funny a minute ago. You said, um, unfortunately, uh, fortunately, you're not alone. Unfortunately, you're not alone. You said both of those things. And I think they're actually both true.
Yeah.
I think it's fortunate that they're not alone in the sense that, a lot of people kind of get it, that they're not the first person to experience this. It's unfortunate that they're not alone in the sense that a lot of people have experienced this problem. And it's fortunate that they're not alone because we know what to do about it. Right, there are plenty of treatments out there to help couples and individuals deal with relationship trauma,
That's right.
whether it's past relationship trauma or things that are going on right now in the day to day of your life. So the what now? I mean, there are lots of things that people can do within the relationship. And if you're in one of those relationships and you've tried all of those things that you hear on podcasts or you've read in books, that your friends or couples that you trust that are further along in their relationships than you, right? If you've tried all those things and it's not working, it may be that there's a different kind of stuck point. Maybe there's some unresolved trauma there for you or your partner that needs to be looked at outside of the relationship, maybe with a professional. That's certainly possible. And given the way that trauma tends to impact not only our relationships, but just the way that we process information at a neurological level, right? The way that our brains encode and retrieve information, memories, that changes when we experience trauma. And there are a few different therapies that are pretty helpful for that. So I would encourage anybody who's in one of those relationships that's just flat out stuck. If you've tried everything that you can think to do, you might think about couples therapy. And if that isn't your cup of tea, you might think about individual therapy. For you as the partner who is trying to just be there for your partner who's experienced trauma, if you're the partner who's had trauma, then maybe it's time to think about getting some help so that you can be the best self possible for your spouse who's just trying to hang in there with you as you go through this really difficult thing.
Yeah, that's really good. I mean, don't do this alone, basically, because these are emotions that are incredibly powerful, and you have to make sense of it all. The more you make sense of it, the more you can address it from there on, right? Wouldn't you
Mhm.
say, Robert? That's the way to do this.
Yeah, and I mean there are the idea of making sense of trauma, I think that's good. I think it's nice for us to have some insight about it. It's nice for us to have insight about our relationships. And yet, most of the time, that's not enough to get the kind of change that we want to see in our lives. So, insight
Okay.
is nice. But a lot of times, there's something that gets in the way of us translating that new information about, oh, I'm this way because this relationship went badly before, or I experienced this trauma, or
Right.
somebody let me down, right? That's good information to have. It's nice to know, to say, okay, I understand myself better. But the moving forward from that sometimes takes what we might call a new experience rather than just new information. So in couples work, we try to provide that new experience in sessions, so that it's not just thinking differently about your relationship, but doing it differently and
Right.
practicing that together, going kind of getting through the bumps together.
Right.
But then also when we think about beyond couples work, right, doing some individual work, it may be that something needs to be processed differently at a neurological level, and that may have nothing to do with thinking differently. It may have to do with an experiential type of therapy, internal family systems therapy, some kind of gestalt or psychodynamic therapy or EMDR. There are several types of therapies that are more experiential in nature and that get away from just having insight. And sometimes that's what's necessary to get through a trauma.
Yeah.
So I think there's a lot that people can do. And I couldn't say, here's the one thing,
Yeah.
because it kind of depends on the symptoms. But there is hope out there. And definitely, you're right. Don't do it alone.
Yeah. Awesome. Dr. Pate, this has been amazing, and I know that many people who are watching will benefit from this. And like I said, we have been dedicated to helping couples get to that equilibrium, to at least be curious about their relationship, be curious about their reactions to one another. The main thing is we are absolutely committed to getting you and your family back on track. If you've gotten off the track, I will have Dr. Pate's information throughout this video, so please give us a call. We are in Southern California, and we're also doing teletherapy as well too. So we can see you if you're in California. We can see you via telehealth like this. We've got that system down, right, Robert?
Absolutely. Yeah.
So, all right. Thanks again for joining us, and stay tuned for the next video. All right. Bye-bye.